My name is Dr. Colin Hawco. I'm an associate professor in the Department of Psychiatry at U of T and a scientist at the Center for Addiction and Mental Health. And I was the 2024 recipient of the Labatt Family Innovation Fund in brain health. In the last few years, there's been an explosion in psychedelic therapies for the treatment of depression and other mental health. My project aims to use brain imaging such as functional MRI to understand the mechanisms of these treatments and how they help patients get better. We hope to identify patients who are most likely to benefit from these treatments and help understand how these treatments work so we can improve upon and streamline these treatments for better outcomes. Using functional MRI, we're able to measure how patients' brains are organized before they receive these treatments and how it changes after they receive these treatments. One of the innovative parts of this study is during the first dosing session, half of the patients receive a placebo, so we can look at the day after treatment how this affects the brains of patients who have or have not received the medication. But also, by the end of the trial, everybody will have received treatment, so we can also see the longer-term effects and how these treatments change people's brain function and how that relates to improvement in their symptoms. Psychedelic-assisted therapy is proposed to work through neuroplasticity. And if we can demonstrate this neuroplastic effect as the primary driver of treatment, we may be able to develop new agents that tap this neuroplasticity without the psychedelic effects of the drug, which may make these more accessible to a broader population of patients who need help. Currently, we're nearly 50% completed with our recruitment. We have almost 20 people who've entered the study and completed their MRI scans. We're beginning to engage in preliminary data analysis to see what we can see from this interesting and innovative design. The Labatt Network helps us bring together researchers working in both functional and structural brain imaging, but also clinician scientists, computational neuroscientists, statisticians, and others. Funding like this through the Labatt Network facilitates research in so many ways. It helps us train the next generation of scientists. It helps us engage in cutting-edge and innovative research. It funds things that the national level funders might be less willing to fund at this time, giving us important early data, which then spins off into other grants, which we're currently working on right now. The Labatt funding we have received is now instrumental to us proposing additional funding through national agencies such as CAMH on the mechanism of psychedelic therapy across different disorders. We are so grateful to the Labatt family for the support for mental health research. It's traditionally been so stigmatized, so difficult to get funded, so hard to break ground in new and innovative research. Research funding like this is just so important to carrying forward new ideas, training the next generation of students, showing patients and families that we care, and that giving people hope.